Pathology of pernicious anemia. Let's review the anatomy first. The esophagus connects with the upper portion of the stomach, the fundus. The middle portion is the corpus or the body, and the distal portion is the antrum, connecting with the small bowel, the duodenum. For practical purposes, this portion, the fundus and the body, we can call that the fundocorporal region. They have the same physiology, they function the same, and the same histology, microscopically look similar. The fundocorporal area shows mucosa, submucosa, muscularis propria with muscle responsible for the peristaltism, and serosa that covers the stomach. Then when we analyze the mucosa, the foveolas, the pits, the mucous layer is 25% of the thickness, and the glandular portion of the mucosa is 75% of the thickness. The lamina propria is the support connective tissue with collagen, lymphocytes, blood vessels, and nerves around the glands. This mucous surface is very important because with water, bicarbonate, and a lot of mucus protects the stomach from autodigestion, the corrosive effect of the hydrochloric acid. These pink eosinophilic cells are the parietal cells in the glandular portion, and they are responsible for the production of hydrochloric acid. And these basophilic purple cells are the chief cells responsible for the production of pepsinogen that under the right pH can be transformed to pepsin to digest proteins. These cells, these clear cells, are very difficult to find, very rare, are the enterochromaffin-like cells responsible for the production of histamine, and only in conditions like this is an abnormal picture with a lot of hyperplastic enterochromaffin-like cells. This is probably proton pump inhibitor, like patient is receiving omeprazole, or the patient has pernicious anemia. Let's go to the antrum. 50% of the mucosal surface with pits and foveolas, most are mucous cells, and the other 50%, the glandular portion, also mucous cells. With immunostains, you can also demonstrate occasional cells that are neuroendocrine, the G cells producing gastrin, and other similar cells, the D cells producing somatostatin. So let's summarize. Fundocorporal cells are mucous cells, parietal cells, chief cells, and enterochromaffin-like cells. And the antrum cells are mucous cells, G cells producing gastrin, and these cells responsible for the production of somatostatin.